I was at a conference earlier this year where part of the conference is you actually sign a thing saying you're not going to talk about stuff because it's pre-published stuff. But the progress that's been made on that and kind of reversing aging in the specific like cardiac cells or in the eye or things like that. I think David Sinclair, he was at the conference. I think he's talked about publicly about some of it if someone wanted to kind of Google that. But there's some just really interesting things coming in the fields of therapeutics when it relates to Yamanaka factors and epigenetic reprogramming.
Do you are you it seems based on the vibe you gave regarding the Alzheimer's and dementia and the interventions we can do and the advancements that we're having in tests and all these other things. I've heard a number of people say that and I've read some like some scientists talking about how like they think that like an actual like effective treatment for Alzheimer's is maybe 5 to 10 years away, which is like if you hear something that's like 10 to 20 years away, they're just like trying to get funding. But if it's under like 5 to 10 years, like it sounds like they might have like a toehold on things. I am not a doctor. I should have said that in the beginning. So I just read a lot. What is your take in terms of us being close to an actual treatment that'll help people?
Yeah. So with dementia, it's such a multifactorial thing. So I mentioned Dale Bredesen and the Alzheimer's and just like 36 holes in the roof to patch. So like with my grandmother, I mentioned her, like we first saw her, when I first saw her, she had a MoCA score, Montreal cognitive assessment score of 16, which is moderate Alzheimer's. And the goal with this disease is just to slow the progression. So you want the MoCA to go from 16, 15, 14, not go 16, 10, 5, not fall off the cliff. So when we started treating her and doing this holistic approach, not a medication or a molecule, but this is a holistic approach and optimizing everything,